Well, good morning. The Ontario government announced on Friday more restrictions to help fight the rise of cases of COVID-19, and I'm sure that kept our next guest very busy this weekend. Hamilton Mayor Fred Eisneberger to see how the city is dealing with these new changes. Good morning, Mayor Fred. How was your weekend?
It's been active. It's been interesting. It's been challenging, like it has been for everybody else. These are tough times, and there's no easy way through this, and certainly we'll keep working to make sure that we try everything to keep people as safe as possible.
Okay, so on Saturday afternoon, the province did reverse two things. The one about police making random stops and also parks. Where were you in those changes and actually initially hearing them on Friday?
Did not support the police check notion that the province put forward, and they heard from many mayors and others across the province, including police services, that indicated that there wasn't going to be any kind of action like that happening in our community. So it really smacked of carding and the kind of thing that we got away from, a couple of years ago. It really doesn't need to get to a police state for us to continue to do the kind of enforcement that police have been doing, which is large gatherings and ticketing and fining when that occurs along and in partnership with our bylaw. In terms of the restrictions on the facilities, I support most of them. One of the more challenging ones is keeping children apart and not allowing them to get socialized in play. It's particularly harmful, and so I do support backing away from that. But beyond that, we're in a stay-at-home order, and clearly that requires people to stay home as much as possible to prevent the spread of this virus. And you know what? It is critical. It is important. It's difficult. It's challenging. But at the same time, it's one of the only ways that we're going to get through this beyond the vaccine. So while we're waiting to get vaccinated, for those that have not yet been vaccinated, it is really critically important that masking continues, physical separation continues, hand washing, all the recommendations still have to carry on. Let's go with the vaccine, because how is the rollouts going in the city? 150,000 people have been vaccinated to date. About 15,000 of those have had their second dose. And we are, capable of doing much more, but we're limited by supply. The good news on the AstraZeneca front is that folks 40 plus on Tuesday can start booking an appointment for a vaccine. Again, it's not an unlimited supply, but certainly it opens the door to those that are willing to take that vaccine, that they can get that starting Tuesday by calling their pharmacy and booking an appointment, and hopefully there'll be enough to go around. I can't imagine that everyone under our 40 plus is going to be able to get vaccinated through this process, but it certainly will go a long way to getting more people vaccinated.
We only got 90 seconds left. Why? We were talking about in the news today, in these hotspot zones, people can go, there's going to be pop-up clinics, but it's only 50 plus. Have you asked why is it only 50 plus, whereas in Toronto it's 18 plus?
So Toronto and Brampton, Peel, much more of a hotspot. They've got a much more critical caseload there. They're up at 1,000 plus per day. We're at about 150 per day, which is, nobody wants to be there either. But the reality is that their caseloads are much, much higher. And so they've actually put more vaccine resources into those locations because of that. That doesn't mean we're not getting a supply, but we're completely limited by supply. So if we open it up to 50 plus, that means that a lot of folks that are in the 60 plus category may get bumped out of getting their vaccine, and they are more at risk than the folks that are 50 plus. So it really is a priority process. But in the hotspots, the extreme hotspots, and some of them are in Hamilton at the 50 plus range. They need more resources and more vaccine, because if we can knock it down in those locations, that certainly helps knock it down across the rest of the province.
And we visit your first message about it is in the community, because 7.4% infection rate yesterday is the highest Hamilton has seen through this entire pandemic.
Yeah, totally. And you know what? In the absence of the things that we're doing right now, we would, well be overrun the hospital system. Right now, there's surge capacity being developed and built at the general hospital, which is going to help. But we'll need, staffing and extra healthcare workers, trained people to actually to be persons that can man those facilities. And so thankfully, the call has gone out through other provinces that are having lesser of a problem to see if they can offer up some healthcare trained staff that can come and help out in these locations. So every ICU bed for pandemic-related COVID requires about 5 or 6 individuals to actually man that facility. So it's an awful lot of staffing, and you can't train those folks overnight. That takes many years. And so we're looking for trained individuals that can help out, and certainly the call around the country is how can you help out in Ontario where the most severe cases are happening right now.
Mayor Fred Eisneberger, we'll leave it there. We appreciate you checking in with us, and we hope next week we have some better news on this as we continue to fight the pandemic. Thank you, Mayor Fred.
Appreciate it. Thank you.